So I'm Stephanie Basso, and I am a board-certified holistic nutrition practitioner. I got my PhD 3 years ago, so I have been a practicing functional nutrition specialist for a lot of my patients. Prior to that, I've been a personal trainer for 25 years, and I've also been in academia. I taught for universities for about 15 years. That's where my passion is education and empowering people to live their best life. And I'm a mother. So many people are in chronic pain, whether it be from inflammation, physical pain, emotional pain, and it's automatic that we become down and sad and feeling hopeless because pain is not something we want to feel. I've dealt with a lower back issue for the past 3 years. I've been being managed with a pain management doctor, and of course their route is for my lumbar, nerve ablations, epidurals, some medication, muscle relaxants, pain relief, and so forth. And 3 years ago, I had to have an L5S1 fusion. So that surgery helped because I was bone on bone. They diagnosed me with chronic degenerative disc disease. And at the same time, 25 years ago, I was diagnosed with Crohn's disease, an autoimmune disease where your body attacks the gut. That was the main symptom growing up. So I received a first fusion L5S1 3 years ago. Exactly 1 year when I healed, a car hit me head on in my car, which caused L4 to L5 to compress and create significant pain in the right leg. So I had to have a second surgery almost 1.5 years later. So now I've had 2 lower back surgeries. And then 16 months later, pain started to increase. I'm a fitness instructor, do a lot of things on my feet, training individuals, very active, fit mom. When this pain started, I remember waking up in my bed trying to get up, and I froze because of the pain. I had to go on my knees. I could not stand up straight. Something froze. My muscles spasmed. I had to have an ambulance bring me to the ER. And so the symptoms were so severe, I've had to go to the ER multiple times, urgent care. I was having to use a cane. So I was in a unfunctionable state. And so now, 16 months after the second surgery, and I'm back to square one with pain, I thought insanity is doing the same thing, expecting different results. And so I said, I've got to do something different. So I went to my surgeons and I asked them, hey, this is what's going on. These are my symptoms. And they said, well, your lumbar right now doesn't show or warrant another surgery. So sorry, you have to deal with the pain. And at the time, my right leg was having edema. And again, I couldn't stand up straight. I was in so much pain. So they would only tell me, go get an epidural shot, which just is a shot to lower inflammation, but it doesn't fix the mechanical issue. Or the only other option was to be given a lot of opioid medication, pain relief drugs. But again, that doesn't get to the root source. It just masks the symptoms. So I was so frustrated, I refused to limit myself to those only 2 options of healing. So just like I was diagnosed with Crohn's a long time ago and I refused to believe there wasn't a cure, I sought out what can I do that will help me address the root issue. And so I just came across stem cell therapy and I went down that rabbit hole to study. I went and studied how do they do it in America versus other countries? And what is the quality, what types of stem cells? Because not all stem cells are created the same. So after consulting with several different stem cell companies, I sniffed out which ones were trying to oversell me. The first company was a very popular company because of celebrities advocating for it. Told them again, my budget is this, and I only want to pay for the science of it. I don't want to have to stay there for 2 weeks because their protocol was to stay for 5 days to 2 weeks. And just what some of them said, I felt was not fully truthful. For example, you need to have all of these pre IVs and things for stem cells to maximally do its work in your body. And then the next thing was, hey, we're going to go intradiscal and you won't need a surgery after that. The promise was too big. And I didn't feel it was genuine. And so TreVita, it popped on my feed as I'm searching for a bunch of different stem cells. So it popped on my feed and I called and had a great consult with Sam. Sam has been amazing since the very beginning, listening to me. He connected me with the doctor for the consult and I got to show all of my background and extensive history. I was able to show him my MRIs, get very specific with what's happening, and he was able to customize my IV amount as well as my injection amount. So I loved TreVita's transparency and their honesty. And I loved my customized approach. So we decided to go for 200 million IV stem cells to help with the autoimmune disease in my body. And then we went with 2 specific 50 million IV injections in my lumbar area where they're inflamed. We set up a date, which was pretty flexible. And I parked in San Diego near the airport, and Mauricio picked me up from that location and drove me into Tijuana. Very seamless process. I didn't even need to have just my passport. And it was a beautiful van. I felt like a special celebrity and, being transferred over to Tijuana. And once I arrived into the facility, Fernando and people were so excited to greet me. They were happy. They had a gift bag for me. And I just felt so welcomed and like they already knew me like family. And I went to the facility. The doctor greeted me. The anesthesiologist greeted me because I ended up having light sedation, conscious sedation for my injections. But the whole process was smooth, kind, genuine from start to finish. And even after the surgery, after the procedure, they still continue to follow up with me and check on how I'm doing. I'm 30 days post now, but the day after, I did not have to use my cane and there was more range of motion in my lower back. They were able to give me 300 million total quality, ethically sourced donor umbilical and placental cells with 95% or more viability. And you cannot find that in America right now. Through putting stem cell regenerative therapy in the body, for the first time in a long time, I finally felt good, like inflammation free. So the results speak for themselves, but before I finally had it, it made sense to me. Let's get to the root issue of what's causing the pain. Let's honor the body, listen to what the body is saying and calm it, again, versus shutting it up and suppressing it. It's priceless to fix yourself at the root level. And you know what I loved about my procedure? I felt so safe and I was feeling privileged of being under the care of these doctors in a different country. I felt so safe and good in TreVita. I was proud. The anesthesiologist spoke excellent English and she was there for me along with the nurse and the doctor. Oh, it was amazing. And their facility is top quality. It was beautiful there. And again, the food is great. The people are amazing. I'd go and do it again. I would love to go every year for just a routine IV. The IV and the injections of stem cells went straight to the fire of inflammation and it calmed it. Again, I was in a cane and a walker. To the next day, I didn't need to use a cane. And I think by day 9, I stood up and there was no pain. That is a game changer. I have just never been so happy again because being in pain, you just kind of don't want to exist sometimes in your body. So now when you're happy and when you're happy, you're hopeful. When you're hopeful, you can live your passions. When you can live your passions, you can change the world and be more creative. But when we're in pain, that creative flow kind of gets blocked. So invest in yourself. Right now, I view stem cells as the most potent anti-inflammatory modulator that anyone can put in their body, a quality one, mesenchymal cells. The most potent you can get anywhere. It's here. Advanced technology, healing technology is here. And our bodies are miracles.